Good morning, everybody, and thank you very much, Anya, for the very kind welcome. And I too can't believe it's a year since I was last here at the Sepsis Summit. And indeed, I'm delighted to be back with you this morning in Dublin Castle to address this, the HSE's fourth National Sepsis Summit. And I want to thank Dr. Vida Hamilton, our National Sepsis Lead, for extending this kind invitation to me to open this event and also to launch the second National Sepsis Outcomes Report. But I too am principally here today to say thank you. I want to say thank you to each and every one of you in this room, and indeed all of those that you represent from your sphere of influence. Whatever your role in our health service, be it as a healthcare professional, be it as a manager, be it as a patient advocate, the difference you are making by adopting the work of the sepsis programme to saving lives in our health service is something I'm extraordinarily proud of as Minister for Health. And when you look back on the journey that we have taken over the last number of years in this country in relation to sepsis, it really is quite incredible. And like any journey and any progress, it could not have been delivered without all of you and all that you represent in your various workplaces. So a sincere thank you for all that you have done to turn a very, very difficult situation in this country in relation to sepsis, and a very, very difficult situation worldwide in relation to the prevalence of sepsis, into what I believe is a positive news story for the Irish Health Service and those who are working in it. It shows that when we put our mind to something and when we work collaboratively, we can deliver improved outcomes for our patients, and that's something that I know each and every one of you hold very dear. Of course, one of my department's most important priorities is to improve patient safety, and sepsis is absolutely a part of this patient safety agenda. Sepsis, as many of you know, is the 10th leading cause of death worldwide and is clearly a global problem. We're privileged indeed today to welcome Dr. Mitchell Levy, who has travelled from the US to share his expertise and experience with us. And we want to thank you, Doctor, for being here with us. I think it's so important when you're dealing with a global phenomenon that we can work together and share international experience. So you're very welcome. And as you say, Céad Míle Fáilte, 100,000 welcomes to Ireland. I'm also delighted that we will hear from Ms. Niamh Boyle, who I've already heard this morning on our national airwaves, very articulately outlining the seriousness of sepsis and the very serious impact it can have on patients, and also Ms. Sarah McAleer. There's so much that we can learn as a health service from listening to those who have been directly affected by sepsis. And patient experiences should and must directly inform all of our work, our service development, and my department has been working very closely with the HSE and with HICWA to deliver Ireland's first national patient experience survey, and we expect to get the results of that survey sometime around November. We measure a lot of things in the health service. We ask a lot of people a lot of questions, but this is the first time actually that we've gone out and asked patients how they find their experience in our health service, and we should have the results and the learning from that later this year. In relation to sepsis, in 2015, there were almost 9,000 cases of sepsis in adult inpatients in Ireland, and this mirrors the international experience. As Anya has already said, sepsis, as we know, can affect a person of any age, from any social background, and can strike irrespective of underlying good health or concurrent medical conditions. In addition, patients who develop sepsis stay longer in our hospitals than others, and it's estimated that compliance with the National Sepsis Programme will result in an additional 500 lives being saved per year, as well as a reduction of the length of stay in hospitals. So clearly, the benefit of this programme is immense and is life-saving. My department requested the National Clinical Effectiveness Committee to commission a clinical guideline for the management of sepsis following the very tragic maternal death from sepsis at University Hospital Galway. The guideline development group was ably chaired by Dr. Fidelma Fitzpatrick, and in 2014, the National Clinical Guideline was published by my department. And as this guideline is now 3 years old, it's now being updated to ensure that we base our health services on the most up-to-date evidence available. Earlier this year, a resolution on sepsis developed by Ireland in partnership with other member states was agreed at the 70th World Health Assembly in Geneva. This resolution on improving prevention, diagnosis and management of sepsis is an important step in improving patient safety. The WHO resolution recommends training in sepsis recognition and management, promotion of hand hygiene, infection control, public awareness, and the use of evidence-based guidelines. We are very pleased to have been in a position to contribute to the development of this international resolution due to the comprehensive and systematic implementation of the National Sepsis Programme in Ireland. This marks significant progression since 2014. I want people just to pause and think about this. We know all the difficulties that we have had in this country in relation to sepsis, and yet we now have actually seen the Irish Health Service showing leadership on an international stage towards the development of this resolution at the World Health Organization. I think that's something that all of you involved should be very proud of, and it's certainly something I'm very proud of as Minister for Health of all the work that you have done. I want to thank Dr. Hamilton for her own leadership on the sepsis programme, and I want to acknowledge the work of the sepsis leads in each of our hospitals in improving early recognition and effective management of sepsis. This team has ensured significant progress in the implementation of our national clinical guidelines. As we know, guidelines are only as successful as their implementation, and the importance of the presence of the sepsis lead and those teams in each and every hospital has turned those guidelines into real operational improvements for patients. We now have a process to monitor sepsis incidence and mortality in Ireland through the HYPE coding, and the first annual National Sepsis Outcome Report using the HYPE reporting data was published last year at the National Patient Safety Conference, which enables us now to monitor sepsis incidence and mortality in this country. And I'm very pleased today to launch the second National Sepsis Outcomes Report. This report shows that Ireland's sepsis-associated hospital mortality rate is now less than 20%, and this benchmarks very well internationally and represents a 20% decrease in mortality since the National Clinical Guideline was published in 2014. And again, that's very solid, tangible progress that has been made since this guideline became operational in our health service. Also, there has been a 67% increase in the number of cases diagnosed, which is as a direct result of efforts of the sepsis committees in all of the acute hospitals and the willingness of our clinicians to engage in this important initiative. And I think this is really important that this figure isn't misrepresented. It's important that this figure is going up, because it shows that we're becoming more and more aware and more able to detect sepsis as a result of the work being done in each and every hospital throughout our country. Sepsis management is absolutely essential for patient safety. It's not just about the prevention of death, it's also about the prevention of lifelong medical problems for the patient. Sepsis must be identified and treated in a timely manner. And as I've said earlier, sepsis is a part of our overall patient safety agenda. And as Minister for Health, I'm absolutely committed to progressing the programme of major patient safety reforms through our National Patient Safety Office. This is a new office that was established in my department last December in order to provide leadership in relation to a number of key patient safety policy initiatives, including the development of new legislation, the establishment of a national patient advocacy service, extending the clinical effectiveness framework, the introduction of a patient safety surveillance system, and the setting up of a National Advisory Council for Patient Safety. Within the programme of legislation we're planning, the National Patient Safety Office is now progressing the licensing of public and private hospitals through the Patient Safety Licensing Bill, which I expect to bring to government later this year, and the extension of HICWA's remit to the private sector via the Health Information and Patient Safety Bill and provisions for open disclosure. The National Patient Safety Office is also supporting the development of our National Action Plan for Antimicrobial Resistance. So today's event has a very exciting and impressive programme that will showcase the many sepsis initiatives that are occurring right across the Irish Health Service, and will clearly show, importantly, the implementation and the impact of all of your efforts and of the National Sepsis Programme and the National Sepsis Guidelines. It's evident from the Sepsis Outcome Report that we're launching today that successes have now been gained in sepsis management in Ireland through an evidence-based, standardised approach, through the National Clinical Guidelines, a national lead for sepsis with a dedicated team, and the development of tools and education for health service staff. But as we all know, there is no room for complacency. We need to continue to build on the successes of previous sepsis summits, and today is an opportunity to acknowledge and share the successes of this National Sepsis Programme and to learn from each other, to learn from colleagues across the health system. I believe that sharing such models of good practice will inform further patient safety initiatives and quality improvement projects in the health services. So I really do want to wish each and every one of you a very informative, collaborative and enjoyable day here today. I encourage you all to continue your dedication and your commitment to ensure patients with sepsis get the best care in a timely fashion. And in a health service that continues to face challenges, I want to take the opportunity today, as Minister for Health, to thank you for your leadership and the progress you're making in this extraordinarily important area. Good morning, Magov.